sickle cell and any type of illness, any type of hardship has some type of wear and tear on our mental health. And obviously, sickle cell is no exemption. You have many hardships because of it, whether it may be the pain crisis, maybe as a result of having to get continuous blood transfusions. Maybe it's because you have having your spleen taken out, or maybe needing to have your gallbladder removed. These are things that many warriors do face and experience, unfortunately. And with that, we want to acknowledge what toll that takes on the mental health of the warrior, but also the caregivers as well. It is Mental Health Awareness Month, and we know that 1 in 5 adults, according to NAMI, 1 in 5 adults experience mental illness each year. 1 in 5. And so I always tell people, if we were to all line up, whatever room we tend to walk into, whether it's a room at home with our family, or a room at work, or even if you're looking around at people in a more public setting like the grocery store, if everyone were to line up and we were counted off by 1 to 5, that would be a great visual for us to see how common it is. And because of that, we want to talk about it. Just as we talk about sickle cell trait, we want to talk about it to eliminate the stigma, so that people who are impacted by it directly and indirectly are comfortable sharing their stories and talking about what it is they may be going through, so that they can get the help that they need. And that's super, super important, because as we said, 1 in 5 experience mental illness in a year. However, only half of them receive treatment. And we know that that could be for a variety of reasons, but included in those reasons would be because of the stigma that is associated with mental health, and whether it's in our families, in the workplace, and in our homes. We know that there is a stigma still, even to this day, attached to mental illness, mental health. So in regards to sickle cell disease and sickle cell trait, as I stated in the book, this piece reads: psychosocial issues such as depression, low self-esteem, poor family relationships, and social isolation can arise from being chronically ill. School grades may be lowered if students miss many days of class. Chronic pain is part of these children's lives, but others sometimes misinterpret such students' reactions to pain as addictive drug-seeking behavior or slacking off. Some patients will become addicted to pain medications. It is important to have good family support, group support, and medical care to help you with all the issues that you will face. And one of the parts of this paragraph that always stands out to me and actually makes me really, really sad on another level is when they are identified, the stigma that we're talking about, identified as being drug seekers, which stresses them out obviously even more, and in many cases leaves them in more pain that goes untreated, because they do not want to enter into the emergency room or whatever environment where they know they are looked at, talked about, and or treated as if they are drug seekers. Oftentimes, the burden is so great for the warriors, from the many reasons I listed earlier, the toll it takes on the body. And many times this happens well before they even enter adulthood, because of all those things that the body experiences and things that they have to go through. We know that their mental health is heavily impacted. I always want to share that if you are in distress, you see this, you're in distress, and you do not have anyone to talk to, please dial 988 so that you can get some immediate help. So if you find yourself in a position where you feel that you may do something to hurt or harm yourself, again, dial 988. It is the Suicide and Crisis Lifeline.